cervical cancer is a cancer which affects the cervix. So cervix is an organ which is the mouth of the uterus. So it is present just below the uterus in the female genital anatomy. Cervical cancer is the second most common cancer in women in India after breast cancer. And it is very common, but it is detected very, very late because of ignorance. And why are we talking a lot about cervical cancer nowadays is that because it is so common, and second thing, it has a screening technique. So there are screening procedures available which can detect the cervical cancer at a very early stage, and which is why it is very important to go through these screening procedures to prevent yourself, because if detected early it can be completely cured, and if detected late it can lead to many, many complications. Pap smear is a screening technique which is used to screen for cervical cancer. So what is screening? So screening is a technique in which type of cancer or cancerous change is detected at the time when it is just about to begin, or it has just begun. Okay, so this pap smear detects cervical cancer at a very, very early stage, even in its precancerous stage as well. Okay, so it is carried out by removing some cervical fluid. Okay, so you will have to visit a gynecologist for that. Your gynecologist will examine you, and while examining, a speculum will be inserted inside your vagina so that your cervix is visualized. When the cervix is visualized, the cells from the cervix will be scraped off using a pap smear stick, and it will be put over a slide, and that will be examined under microscope to detect if there are any cervical cancer changes or not. This cervical cancer screening procedure is ideally should be performed every 3 yearly if there are no abnormal changes into the test or the pap smear results. So it is very, very advisable that if you are sexually active, then you should undergo this test every 3 years. Ideally, you should start screening for pap smear after the age of 21. But if you are sexually active, then after being sexually active, we advise to go for pap smears after every 3 years. So supposedly, if you get sexually active at maybe 18, then you should start from 21. If you are sexually active at 19, then you should start from 22. So that is the perfect timeline. You should start going regularly for pap smears. Pap smears are not at all expensive. So pap smears might cost somewhere around 500 rupees to 1,500 rupees, depending upon which city you stay in. They are very, very cheap according to the function they are doing. Okay, so it is very important that you go ahead and get these pap smears done. If you're going into a cancer institute, which is specifically dedicated for detecting cancers, then you might get a pap smear for free as well. So don't restrict yourself for the money issues. The procedure involves visualization of the cervix, for which we need to insert an instrument into the vagina. But obviously, the doctor who is taking your pap smear will make sure that you are comfortable, and the procedure is non-traumatic. You can ask your gynecologist about the complete procedure, what is going to happen, and then you will get your anxiety relieved as well. It can be a little painful, but with everything understood and being gentle, I think it will not be as painful as expected. It can be very, very smooth if you know the procedure well prior to going for examination. The do's before going for pap smear: make sure that you have your genital area clean. It's not necessary that you go for maybe a waxing or a shaving. Just maintaining cleanliness is important. Just make sure that you're not on your periods. You do not have any active vaginal discharge. Do not go for any vaginal douching, or if you have been sexually active in the past night, make sure that you are not sexually active for more, 2 consecutive days before going for pap smear. So those are the do's. The don'ts are, if you have any kind of bleeding, make sure that you treat the bleeding first. If you have periods, then make sure that you go for the pap smear when there is no bleeding. Other thing is, if there is bleeding for some other cause, make sure that you treat it first and then go for pap smears. Do not use any douching. Do not use any perfumed material near your vagina. So those are the don'ts which you need to know before going for pap smear. Basically, having semen or any foreign fluid into the cervix can hamper the results. Okay, it is not that it will 100% hamper the results, but it can hamper the results, which is why if we want to know any infection or anything about the virus, it is important that there should be no foreign object inside your vagina for maybe more than 24 hours. If you are going for protected intercourse using a barrier contraceptive, then it is completely allowed before going for pap smear. Make sure that you're not using flavored condoms, because that can increase the sugar quantity and can make you prone for the vaginal infections, and that can show in the results. After you get a pap smear, make sure that you are cleaning your vulva. There is no necessity to clean your vagina. If there is some discharge over your vulva, then make sure that you wipe that out. Supposedly, if you have any pain or any bleeding post pap smear, make sure that you inform your gynecologist immediately, because that should be addressed. You can resume your sexual activity immediately after going for a pap smear. There is no restriction after having the pap smear. That's it. Someone can definitely accompany you during the pap smear. It is make sure that you inform your gynecologist that you want someone by your side while the pap smear is taken. It is very, very common that you can feel anxious while going for pap smear, because it involves a little bit of examination of genital areas, and that can be very scary for some people. So ask your doctor about the complete procedure, know the procedures, maybe see those instruments first, and also ask your doctor, how can I relax myself? So she will tell you some relaxation techniques going ahead with the pap smear, and immediately indicate it to your doctor if you feel that the pain is too much and you can't handle it anymore. Okay, so immediately flag it out so that the procedure will be abandoned then and there. Pap smear is one of the very specific tests for detection of cervical cancer. It is not very expensive, and it can be done within minutes. You can get the results within a day. And nowadays we are seeing so many patients coming up with cervical cancer, and which could have been detected maybe 5 years prior, and they are coming to us at a stage of stage 3 or stage 4, where it is very, very difficult to even make them understand that their life is hampered for the next maybe their survival rate is also decreased. So it is very important that you understand the importance of pap smears. You yourself, along with your friends, along with your family members, go and get your pap smears done. It costs less than a burger. Okay, so make sure that you are getting ahead. If you are anxious, talk to your doctor about it, but do not prevent yourself from getting tested.